quite frankly, public health is under assault in the US today. But there are also huge global implications. Health is not a win-lose situation. Health is a win-win situation. When other countries are healthier, all of us are better off.
Hi, Mr. Frieden. Welcome to Health Talk. We're pleased to have you. You were appointed as the New York City Health Commissioner and also CDC Director and made remarkable progress in tobacco control and also chronic disease development. What are some of the best practices that you can share with us that may have measurable impacts on public health outcomes?
What really works to improve health is first to figure out what's actually happening, to have good data on what people are getting sick from, what they're dying from, and second, to have good information on what really works to address those problems. This is key to understand the biggest problems that have the clearest solutions, and then to work single-mindedly to implement those solutions. Because if you do, you can get enormous progress. You can save millions of lives.
From your interactions with China, what do you think are the advantages and areas of improvement in the country's public health system?
I think some of the basic research China is doing is very impressive. Some of the new technologies are impressive. And some of the large hospitals are world-class in terms of the care they're giving. Where the progress will be made, where the most health progress will be made, where the most effective investments will be made is at the essential care level, making sure that the core health interventions are done right. Blood pressure control, lipid control, treatment of people with diabetes, support for people to quit tobacco use. These are the things that save lives and save money.
In your view, what is the most pressing challenges in global health today?
We have a difficult situation made much worse, very abruptly, by the current US government, which has pulled out of programs ranging from HIV, malaria, tuberculosis, immunization, polio, and I'm very concerned about this. I serve on the Independent Monitoring Board for Polio Eradication. We've been very close to eradication, and right now the risk is the US will pull the rug out from that effort and polio could come roaring back. We have to continue to make progress, and globally, I think that's also going to require more focus on this core essential health services, primary health care, because this is the most cost-effective, efficient, and high-impact way of saving lives.
We know R.F. Kennedy has announced cuts to U.S. health agencies. How do you view the implications for the U.S. and beyond?
I'm very concerned by what is happening. The U.S. Centers for Disease Control and Prevention was the world's leading health prevention agency. The CDC has been behind a lot of the health progress in the United States, everything ranging from fewer birth defects, safer workplaces, fewer cancers, heart attacks, and strokes, less infections in hospitals. All of that is at risk within the US because, quite frankly, public health is under assault in the US today. But there are also huge global implications as the US reduces its funding for life-saving groups like Gavi, the Global Fund, PEPFAR. Fundamentally, what we need to do as a world is support each country in the path that it chooses for a healthier future.
What do you think are the prospects of China-US cooperation in the future in addressing all the above challenges, especially at a time where geopolitical tensions can sometimes overshadow shared interests?
I hope there can be collaboration. Health is not a win-lose situation. Health is a win-win situation. When other countries are healthier, all of us are better off. They're more productive, they can buy more things and make more things, there's less instability. I hope we can work together to support health around the world. One of the important roles of non-governmental organizations is to promote person-to-person communication, to reduce tensions, to recognize we're all the same in so many important ways, and we all have complementary skills, strengths, capacities, resources. And if we're committed to global health, if we're committed to saying that no one in any country should die from a preventable disease, then we work our best to make that difference.